Yeah, here.
Hello, parents and babies. Welcome to my channel. I'm Heng. Nice to meet you. Today, our workshop, we will talk about how to do hands-free breastfeeding. I have seen many moms, they are suffering from joint pain, finger pain, hand pain, and arm pain, carpal tunnel syndrome, and tennis able. When you are recovering from birth, your body is very weak, and breastfeeding takes a lot of time. So try to do hands-free breastfeeding. Try to teach your baby to hold you and keep balance on your body. That will help with speedy recovery. Today, I will show you how you can do it. First, we can try the sitting position. When you are sitting, make sure you use your upper body's pressure on the sit bone. Upper body's pressure on the sit bone instead of adding pressure on the sciatic nerve. So when you sit, prevent lean back to the couch or to the chair. Sit upright, and these are the sit bone on the chair or couch. And you can use pillows. And towels to support baby's body. I know many moms use the nursing pillow, and when you put a nursing pillow on, there may be a gap between the pillow and your laps. When there is gap, some mom lift your leg to support the nursing pillow or support the baby. That may cause some hip pain and knee pain, because when you lift one leg, the pelvis, the joint tilt. Yeah, so we need to keep good posture to prevent postpartum injuries. When you put the nursing pillow on, if there is a gap, we add one more pillow. Underneath the nursing pillow. And this will help you to keep a good posture and prevent joint pain, knee pain, hip pain, and shoulder pain. Okay, so sit upright. Make sure you have good support on your back. You feel comfortable. And when you position baby on your body, first position, we can try the cross cradle position. How you hold baby's head. When we say, hey, mom, hold baby's head. In fact, your hand is on baby's neck, not on baby's head. See, this is a baby doll. When we hold baby's neck, hold baby's neck. Naturally, baby can tilt up the head, get good support. When baby tilt up the head, that will be easier for baby to open mouth widely. So hold baby's neck instead of head. This will help baby to open mouth widely. And we position the breast in U shape. We make breast flat. That will be easier for baby to have a deep and good latch. Imagine when you eat a sandwich. You open mouth widely, you make the sandwich flat. That will be easier to have a big bite. So we do the U shape. hold the breast and support baby's neck. This is a good tip. We place baby's one arm underneath the breast and another arm on top of the breast. See, you can see baby is hugging the breast. Baby is in the neutral position in front of the breast. In front of the breast. Okay. So once you get the good latch, you feel the latch is deep, not painful, and baby start to suck, swallow, then you can roll a towel. Roll a towel and position behind baby's back. Position behind baby's back, and we make sure nothing block baby's head. Nothing block baby's head. And some mom ask me, "Hi, hun, I really worry about my breast is on baby's nose, block baby's nose, baby cannot breathing." Please don't worry about that. First, you can try. You hold your nose. If you cannot breathing, you cannot suck, the same as your baby. If baby's nose is blocked, baby is not able to suck. And when we use the towel support baby's back, we make sure nothing behind the baby's head. So if baby feel difficult breathing, baby will move the head. Baby will adjust. And also we have baby's arms. Baby two arms hug the breast. Hug the breast. So if baby want to adjust, baby will use hands or arms to push you. Yeah, so don't worry if your breast blocks the nose. And sometimes we may need the nose to touch the breast to have a good and deep latch. So this is the tip. You use a pillow or small towel, roll a towel, support the baby's back. Support the baby's back. And this is hands-free breastfeeding position. When you do the cross cradle position, let me demonstrate one more time. U-shape hold the breast and support baby's neck. Baby's spine is on your forearm. Spine is on your forearm. And position baby on. One arm underneath the breast, one arm on top. Baby hug the breast. And once baby has a good deep latch, we position the towel behind baby's back. Now you can watch TV. This is hands-free breastfeeding position for cross cradle position. Okay, and another position we can try. Football position, how to put baby on the side. This is a very good position for mom have had a C-section. You don't want to add more pressure on your belly, on your incision area. So you position pillows on the side. And you may need two pillows. And lift your baby's body. And now I'm going to demonstrate how to do the football position to have the hands-free technique. With the football position, you still need to shape your breast U-shape. Look at my finger. This is the U-shape on the breast. And the same technique, hold baby's neck. So baby is able to tilt up the head and baby's spine is on the forearm. Baby get good support, U-shape, and put baby on. Baby start to have a good deep latch. We use underarm support baby's back and hip. Baby hug the breast. Baby hug the breast in the neutral position. This is how you can do the football position for hands-free technique. And you can also use the towel or small pillow support baby's back. See, this is hands-free. It's very good for C-section moms. There is no pressure, no stress on the incision area. Baby will not kick your belly. It's very safe and you will feel good support on your lower back, on your hips. Football position is good for C-section moms. Okay, so this is the right side. Let me demonstrate if we want to switch. Yeah, baby is done with the right side. How we can switch to the left side? Easiest, fastest. Okay, you bring the pillows. Bring the pillow. Break the latch. Break the latch. And we support baby. One hand support baby, another hand brings the pillows. Twist. We switch. This is an easy way to switch. Okay, from left breast, we do the cross cradle with pillows. Left side, cross cradle, down. We switch to right side. Easy. We just switch pillow. So you don't have to, change baby's head. Oh, baby change baby's head. That's the easiest way to switch side. Yeah, from left side to right side. Left side, cross cradle, and breaks the latch. We change pillow and right side football position. I need to switch back. Yeah, left side, right side. And when you use the pillows, you can have towel to support baby's back. This is how you can do the sitting position. Yeah, I will do this side. See, U-shape, hold the breast. Yeah, U-shape, hold the breast. And baby, one arm underneath the breast, one arm on top. And have a good latch. Have a good latch. Once baby is sucking, swallowing, and doing a good job, we can use pillows to support baby's back. This is how you can do hands-free breastfeeding. You don't have to hold baby all the time. These pillows give baby's head good support. And we use towel to support baby's back. We make sure don't block baby's head. So when baby want to adjust, baby will have space to move the head, and baby's arm hugs the breast. So baby's arm hugs the breast. That's a good stimulation. Skin to skin will help you to increase oxytocin. And when baby feel, oh, I have had enough milk, baby may use a hand to push you. Yeah, to push you. Or baby feel, okay, I want to adjust my head a little bit. I want to get more air. Baby may use hand to push you. So this is how you can do hands-free breastfeeding for cross cradle position and football position. Now I'm going to show you how you can do lying down position. How you can do lying down position. Okay, I suggest moms have 2 pillows. So you can have your body, yeah. Many moms, when they want to lift the head, they use the hands to lift the head. That may cause some joint pain, hand pain, and arm pain. So if you want to lift your head, please use two pillows. Use two pillows, and you can use, if you want to use your hand, lift your head, you can put your hand between two pillows, yeah, to lift your body. And now I'm going to demonstrate how to do the side lying breastfeeding. Yeah, when you do the side lying breastfeeding, there are two ways to do it. Yeah, upper body lift a little bit, and this is a U shape the breast, and still hold baby's neck. Baby is on the bed. When you do side lying, there are two ways to position baby's arm. The one at the bottom, the arm you can put straight, yeah, put straight on the bed, or you can put up underneath the breast. For the bottom arm, there are two positions. Put it down or put it up to hug the breast. U shape with breast and support baby's neck. Okay, and arm can be down or arm up to hug the breast, and the top arm hug the breast. Once baby is on the bed with good latch side lying position, you can put the towel. You can roll the towel to support baby's body. And this top arm just gently place around baby's body. So baby will not roll. And for older baby, 2 or 3 months old, baby's body is longer, you may be able to put your upper leg cross on top to hold baby's legs and feet, so baby will not roll. So this is another hands-free breastfeeding positions for side lying. You don't have to use your hands to support your baby. Once baby is latching, baby can learn how to place a good position and keep a good balance on your body. When the bottom breast is down, you can hold baby, roll to another side to face the second breast, or you can do lean forward. Yeah, we call this is first floor breast, and when the first floor breast is down, we can fade the second breast. Okay, the second breast, first floor, second floor. When we fade the second floor, we can leaning forward. To fade the second floor. So that's the technique. You can save time. Yeah, especially at night, you are super tired. You don't want to move too much. When the first breath is down, you're leaning forward. Fade the second one. So this is the technique. First floor breast and second floor breast. Okay? Yeah. This is for the side lying position. And we can also do face up position. We call this is lay back position. You lie down, you can use 2 pillows and let your head is up a little bit so you can see how is your baby doing on your body. You hold skin to skin. Baby is happy and relaxed. And you shape your breast. Look at where baby's mouth is. U shape makes the breast is flat. Net baby's chin. Net baby's chin on the breast first. Net baby chin on the breast first, and nose up. Nose, the nipple point up towards baby's nose, and help baby to have a good latch. Yeah. Once baby is latching on, gently place your forearm on baby's bum. Yeah, this is another way to have hands-free breastfeeding. Hands-free breastfeeding. This is biological breastfeeding position. Baby's belly is on your belly, and when baby's head is on your breast, that's a gravity. That's a gravity to help apply more compression, more positive pressure on your breast, and the nipple will be naturally go deeper to baby's throat, and help with the deep latch. So this is a position. Yeah, this is a position. Gently let baby do tummy time on your breast, and also breastfeed at the same time. Tummy time and breastfeeding time together. Tummy time and breastfeeding time together. This is how you can do it. We call this is lay back position. Hands free. Hands free. You can gently just place your hands on baby's body, but you don't add baby's body weight on your arms and the hands. All of the hands free breastfeeding position, we want to teach baby keep a good balance on your body instead of you hold baby. This is your baby's food, and baby is learning how to keep balance on your body. This is lay back position. Okay, this is lay back position. You can try. Okay, and when the lay back position is done, you can place baby in the middle of your chest, and baby's head may turn to one side, turn to left side, or turn to right side. Gentle burp your baby. Gentle burp. This is lay back position for breastfeeding. Lay back position for breastfeeding. Okay, and there is another technique we call it how you can stand and do hands-free breastfeeding position. So imagine this pillow is a table, the surface of a table. The surface of a table. This is a table. You can sit next to the table or stand next to the table and position your baby on the table, and you use your underarm. Yeah, gentle hold your baby's body and position baby on your breast. So even when you are standing, yeah, position baby on the table, on the edge of the table, you can still breastfeed with hands-free technique. Okay, see, this is how you can feed baby with a table. You stand or you sit next to a table. This is the hands-free position for standing position. And okay, let's recall all of these positions. Why we want hands-free breastfeeding positions? When a new mom is recovering from pregnancy and birth, your body is going through a lot of difficulties. We want to make sure your recovery is priority. We want you get a lot of rest, and the breastfeeding can take a lot of time. It's more than a full-time job. We want mom can get rest as much as possible. So for the breastfeeding time, we want to use towel or pillows to support baby's body instead of mom's hands, arms to hold the baby. You may get tired. Yeah. And when your baby is 5 pounds or 6 pounds, your baby is so cute, so small. You want to hold your baby every day. That's doable. Yeah. And baby will grow day by day. When your baby is 10 pounds, 12 pounds, 20 pounds, if you keep holding baby for a long time, you may get tired, you may get a hand and arm injury. So the breastfeeding position, hands-free breastfeeding position, I wish every mom can learn, every breastfeeding mom can learn, because that will save your energy, that will prevent injury, prevent chronic pain, joint pain, and help with speedy recovery. So we learn hands-free breastfeeding. Cross cradle position, never use your leg to lift. Never use your leg to lift baby's body. Use pillows. Yeah, one pillow. Oh, it's so low. When I put one pillow on my lap, baby is so low below my breast. No problem. We use another pillow to support. It's two pillows. Two pillows feel more comfortable. Use pillows to support baby's body and let baby's body weight on the pillows instead of your hands, arms. That will help with recovery. That is a good self-care technique. And we do cross cradle position. Cross cradle position. Hold baby's neck. Yeah, usually we say, hey mom, please support baby's head, hold baby's head. When we say that, it doesn't mean your hand is on baby's head. Your hand should be on baby's neck. See, where I position my hand to support baby's head, it's on the neck, underneath the ear, support baby's neck so baby is able to tilt up the head. We do the cross cradle position. Once baby is on the breast, we use pillow or small towel to support baby's back. We make sure we just support baby's back. We don't block baby's head. Because baby may adjust the head during feeding sessions. Yeah, so we just support baby's back. Once we support baby's back, baby's face is in towards your breast. Baby's head tilt up, so baby's eye look up, about 45-degree look up. Baby's eyesight look up, and baby's one hand support underneath the breast, one hand on top. Baby is hugging your breast. Okay, and this is hands-free breastfeeding for sitting position, cross cradle position. We just position baby on the breast, let baby do the work. Baby know how to keep good balance on your breast, and baby have good muscle memories to remember at this moment how to position the head, how the neck work, how the back muscle work. Baby, remember that the more you do it, the better your baby and you will be. Yeah, use towel support baby. Yeah, baby is sucking, swallowing, breathing, rest. Her baby is doing good. You feel baby start to make some noise. What does that mean? Means baby may have a wet diaper. Baby may want to change diaper. Baby may have burp. Baby need help with burping. You can burp your baby, burp your baby. Or if your baby has a wet diaper, some baby is very sensitive with wet diaper. If your baby is fussy with the wet diaper during the feeding session, please change your diaper for your baby. If baby feel fine with a wet diaper, you can change a diaper later after the feeding session. Okay, burp, then we can switch to another side. When we switch to another side, the same technique, U shape makes the breast flat, easier for baby to have a good deep latch. Once the arm is underneath the breast and the top arm hug the breast. Hug the breast. Okay. Once baby is on the breast, very good. I can feel the latch is deep. I feel the latch is very good. Yeah, no pain. And baby suck, swallow, pause, rest, breathing. Wonderful. Then we put a towel behind baby's back to support baby's back. This is a very good latch. Okay, and when I put baby on the breast, I feel, the latch is shallow. I feel pain. If you feel pain, mom, if you feel pain, please don't hold the pain. When there is shallow latch, baby may not be able to transfer sufficient milk from your breast, and you may get hurt, and you may have nipple damage, nipple injury. So please break the latch. Break the latch and try it again. Try it again. We break the latch. Please ask yourself, okay, if I feel comfortable with the latch, if you feel the pain level even is 1 out of 10, please break the latch and try it again. Good latch should be pain-free. Deep latch should be pain-free. Okay, this is a good deep latch. Then we put the towel underneath baby's behind baby's back and support baby's back so baby will not roll. And you can use another arm, just place cross baby's body so baby will not roll. Yeah, support with pillow and support with your arm. For sure, baby will not roll, and this is very safe. And another hand, when you are awake, you can drink water, you can eat and watch TV. And I want to make sure every mom knows that if you are super sleepy, the easiest position is to lie down. That is the easiest way to feed your baby. So you can rest your body. You can rest your body with lying down position. Yeah. When you are super sleepy, lying down position is more comfortable. Lying down position, you use two pillows. You can use two pillows. Please try not to use your arm to support your head. Your head can be heavy. Yeah, you don't want add more pressure on your hand. Your hand should rest because after birth, the hormone change, the joints can be weak and may easily get injury. Use two pillows. If you want to lift your head, use two pillows and put your hand and arm underneath the pillow. So that's the side lying position. Side lying position. One hand holds breast and one hand hold baby neck latch. Once baby latch, you still hold your breast and hold baby slowly, slowly move down and knit your breast. Place on the surface of the bed and baby's body on the bed. Once baby is lying down, you put the towel behind baby's back to support baby's back. This is side lying position to have hands-free breastfeeding, and you can also support your breast and hold baby's neck gently roll. Baby is on the top of your body with the gravity. Baby's head is on your breast. Naturally, your nipple can go deeper inside baby's mouth and which will help with deep latch. This is another position, lay back position for deeper latch. Lay back position for deeper latch, and baby is natural belly feeder. This is a good position, and baby use arms and the body keep a balance on your belly. So we take advantage of the gravity instead of you use hands and arm hold baby's body. Your baby may be 10 pound, 12 pound. So we use arm, just gentle place on baby's body. You hug baby, but baby's body weight is not on your arms and hands. So we call the hands-free breastfeeding is once baby's body weight is off. Baby's body weight is not on your arms and hands, so you can get to rest. You can have less pressure on hands and arms. That can help you to prevent joint pain and injury. Okay, so this is the lay back position. When baby is down, your baby may turn the head. Baby may use hands to push you. How you can switch from one breast to another breast. Okay, so baby is down with this side, and we gentle move. See, this is the lay back position. Baby cross the body. If you feed the left breast, baby cross baby's leg on the right side. If you feed the right breast, baby's body is on the left side. Cross body is an easy way. Yeah, it's easy way because that can prevent baby's legs and feet in the middle and kick your belly. Okay, so cross way. Lay back position. Let baby use arms and hands. Hug your breast. Lay back position. Once baby is having a good latch, your arms and hands just gently place on top of baby's bum. Yeah, just rest. Rest. And when baby is done with one breath, watch baby. Yeah, baby may need to be burped. Yeah, for short time. You can put your baby on your chest and burp a little bit and switch to another side. Switch to the right breast. Yeah, when we switch to the right breast, baby is crossing the body. Baby's legs and feet is on the left side. Yeah, cross the body. Support baby's neck. Support baby's neck and we shape the breast nipple up and help baby have a good latch. Let your baby use hands and arms hold you. Yeah, hold you. Gentle baby's head, gentle press on your breast, and that will help to stimulate letdowns. This is the hands-free lay back position. We learned how to do hands-free cross cradle position, hands-free football position, and hands-free side lying position, and hands-free layback position. When you stand, you leaning towards a table, you can position baby on the table, on the edge of the table, and you can do hands-free breastfeeding with standing position because we want to use something else, pillows, towels, or a table, other thing to support baby's body weight instead of your hands and arms. Your hands and arms just to keep the balance. You can use your hands and arms to keep balance, and you can also teach your baby use hands arms to hug your breast and keep a neutral position, keep a good position on your breast. This is the techniques. This is the idea to help you with a speedy recovery. Breastfeeding time in the first 3 months, average breastfeeding mom may spend 8 to 12 hours daily on breastfeeding. If the 8 to 12 hours breastfeeding time, you use your arms and hands, shoulder hold your baby, maybe 10 pounds baby, you will get so tired. Your shoulder, your arm, and your hands may get injury. So the hands-free techniques are teaching you to use something else to hold baby's body instead of your hands and arms hold your baby during the breastfeeding sessions. Okay, we learn the feeding positions, and now you may have question how to put the breast and baby together. I want to show you the techniques how to put breast and baby together. We want good position and good attachment. Good position and good attachment. First, we learn how to shape the breast. How to shape the breast. There are two ways to shape the breast. This is C shape. Look at my finger. C shape. C shape. And this is U shape. U shape to hold the breath. C shape and U shape. Now you have a question when we should use C shape, when we should use C shape, when we should use U shape, depends on baby's position. If you use the cross cradle position to feed your baby, we use U shape. We use U shape, this position. If we hold baby with the lay back position, we use C shape. We use C shape. When baby is horizontal, we use U shape to feed baby. When we use a lay back position, we use C shape. We use C shape to hold the breath. And how about football position? Football position, baby is on the side. We want to make the breast flat. We use the U shape. We use a U shape. U shape. U shape to hold the breast, make it flat. Why we want to shape the breast? We want to make it's easier for a baby to latch. When it's easier for baby to latch, that baby will like to have a good latch and deep latch. We help baby. So imagine when we eat a sandwich. This is a sandwich. When you eat a sandwich, 3 or 5 layers. It's thick. It's difficult to have a bite. So how do we eat the sandwich? We make it flat. When we make it flat, easy to have a bite, big bite. Right? We make the sandwich flat. If we make the sandwich this way, that's too thick. That's difficult to have a big bite. The same as baby's latch. The breast is round. Baby don't know, how we can have a big, deep latch. It's so round. How I can do it? We make it flat. We make it flat, baby will have a big open mouth, hold more breast tissue. That's how we can shape the breast. Okay, so we learn how to shape her breast, and we learn how to hold baby's head. We hold baby's head, but our hand is on the neck. Please remember that when we support baby's head, our hand is on baby's neck. We support C shape, big C shape, cup baby's neck. So baby is able to tilt up the head, get good support. When baby tilt up the head, naturally the chin will drop and open mouth widely. See, if we apply pressure, we put hands on the head, especially the back of the head, the chin will tuck. When the chin tuck, that's difficult for baby to open mouth widely. So we support baby's neck. Yeah, parents, your hand is underneath the ear. Your hand is on baby's neck. Your hand is on baby's neck. Baby get good support. Baby feel safe to tilt up the head. When tilt up the head, the jaw naturally open up. Okay, and support baby's neck, and baby's spine is on your forearm. And we already get some milk out and start to stimulate and help baby to open mouth. Yeah. Open mouth. We shape the breast, C shape, and head up. Baby open mouth, baby open mouth, baby open mouth. And when baby start to open mouth, baby don't know where to go. Baby open mouth, baby cannot see your nipple very well. We use our touch, baby. We help baby have the sensation. What is the feeling? I want to feel breath. I want to know where to go because I cannot see the nipple very well. Okay, we use our hand to lead baby's chin. This is a point. Chin, reach the breast. Reach the breast. Let baby get good support. Okay, baby, this is where you can go. Okay, chin on the breast first. Baby still open mouth. And the nipple. Nipple point up towards the nose and slightly roll inside baby's mouth. See, if this is baby's mouth, the nipple is on top, reach the roof of your baby's mouth. Stimulate, baby start to open mouth. And then let the chin on the breast. And baby open mouth. Let the nipple slide inside baby mouth through the upper lip. This is the 3 point. Chin, bottom lip, upper lip. Chin, bottom lip, upper lip. This position will help your baby have a good deep latch. Please make sure you don't insert nipple inside baby's mouth directly. This will not work. When you insert your nipple inside baby mouth, like how you plug the charge, that will not work because when you insert a nipple inside the baby's mouth, baby's tongue will retract. When the tongue will retract, baby's tongue will have no space to move up and down like a wave to apply compression on your breast, on the areola area. So if the tongue doesn't have space to move up and down, don't have space to work, then what to do? Baby will compensate with the jar, and the jar will naturally close. Use the gun to chop your nipple. So that's why some moms say, hey, my baby doesn't open mouth widely, and my baby use the gum to bite my nipples. Yeah, because how you position the nipple inside baby's mouth need to improve. Yeah, we need to position the nipple in the upper side towards the roof of baby's mouth. This is a good deep latch. And once baby latch on your breast from the side, you can see baby's cheek, chin is on your breast. So baby's cheek and chin on your breast, so baby can apply compression on your breast to stimulate let downs. And some moms ask me, hi, Heng, every time I see baby's nose on the breast, I worry so much. So I always do this way. Yeah, prevent the nose on the breast, but it depends on your breast shape and size. Sometimes when baby is doing a deep latch, baby's nose need to be on your breast in order to have a deep latch. Don't worry about that. When baby's nose just touch the surface of your breast, baby can still breathing from the side, from the sides. Yeah, just a touch, baby can still breathing. Baby can still breathing. And you can do a test. You hold your nose. If you cannot breathing, you cannot suck. It's the same as your baby. If your baby is not able to breathing, baby is not able to suck. As long as your baby is breastfeeding, baby is sucking, baby is swallowing, baby is able to breathing. If you want to prevent the nose on the breast, if you pull, yeah, you pull your breast tissue away from baby's nose, away from baby's mouth. That may prevent a deep latch. That may prevent a deep latch. So we want baby's chin, baby's cheek on your breast, and for baby's nose, depends on your breast size or shape or texture. Sometimes the nose may have to be on the surface of your breast in order to have a deep latch. That's okay. That's okay. So baby's face need to face your breast and touch on deeply. Touch on your breast, especially the chin on your breast, apply compression to have a deep latch. So these are the good deep latch technique. Nipple is on the top, reach the roof of baby's mouth. And we support baby's neck. So baby is able to tilt up the head, have a good deep latch, open mouth widely and stick out the tongue. Tongue will have more space to move up and down. Good position, good attachment, and I hope every mom feel breastfeeding is successful. Breastfeeding is easygoing and with a lot of happiness and joy. Yeah. When the breastfeeding is easygoing, you will want to do it daily. Yeah, you will look forward to every breastfeeding sessions. And these hands-free breastfeeding sessions can help moms to have speedy recovery and have a relaxing breastfeeding experience. Yeah, thank you. So this is a good session. We demonstrate the techniques. Now I would love to answer your questions. Yeah, please feel free to post your questions. I would love to answer your questions about the hands-free breastfeeding.